Wellbeing. Karen,
Lovely, thank you.
I'll hand over to you now.
Thank you very much, Lindsay. And I'm just going to bring up the screen and just as Lindsay says, this is the fourth slot of the day. Hopefully we haven't got to sort of a bit of fatigue here before the lunchtime slot begins. But I'm just going to share with you a little PowerPoint that I've put together. So hopefully that'll keep you all kind of fresh and energized and engaged. And first of all, thank you very much for having me along here today. It really is a privilege to speak at the conference here. And parenting and mental health is so important to so much of the work that we do at Relate NI. So we're absolutely delighted. And I was absolutely delighted that Michelle came up with the title for today about building the tribe. And I love a theme, and I've just realized myself and Paula Bradshaw have something in common, because listening to her earlier, she loves the theme, whether it's Halloween or Christmas or anything like that. So I think I'm going to have to compare notes with her Halloween decorations. So kind of taking that theme and running with it, I kind of thought, well, building the tribe, what does that mean? And more importantly, how can, everybody here today is part of that, and how do we do that? And what does that look like for us all? And how do we be committed citizens? So I'll come on to how I came up with that kind of phrase in a little moment. So some people maybe have heard this kind of story. It's sort of become quite folklore now. A very famous American anthropologist called Margaret Mead, she was asked once by one of her students, what is the first sign of civilization in our culture? And thinking that the response was going to be something sophisticated, like, early pottery, or perhaps, flint tools, or a sophisticated kind of burial process or something like that. But she kind of astounded them by saying that the first view of civilization in her mind was finding like an early remains of a human being where the femur bone had actually broken and then healed. And the reason for this is because it indicated for the first time that here are societies, here are like tribal communities that actually cared for and nurtured one another in the times of their greatest vulnerability, because if they weren't looked after, then they wouldn't have survived. And I think that's a really powerful message of what we've begun with here today, and Lindsay has brought up, and we and Michelle has brought up as well earlier in talking about how important it is to care for those people that need it at the time that they need it. So she went on to say, helping someone else through difficulty is where civilization starts, and never doubt what a small group of thoughtful, committed citizens can change the world, for indeed it's the only thing that ever has. And so kind of looking at us here today, we are those thoughtful, committed citizens. You've all given up your time to be here today, and that's so important. And it's amazing what we can do already. I'm quite amazed at the parent rooms, how far this regional tribe that Michelle talked about earlier has got to. And when you saw the diagram of all the plotted points of people who have used the service, and again with ourselves in Relate, we see people coming forward in all different ways, and we've adapted and changed obviously the last 18 months, and we're reaching more and more people who maybe wouldn't have accessed our services before. So I think just bearing that in mind, and how can we all grow on that momentum and grow together with that. So I suppose a few things that came to my mind on, what does it mean to be a committed citizen, and how do we use that momentum then to build this tribe that we were talking about. And there's a few key areas I think stand out for me, and there's probably others that I haven't thought of, so please feel free to add those at the end. But certainly with regards to stronger relationships, and I'll talk about each of these in turn in a wee moment, but stronger relationships to build stronger communities, supporting those transitions, particularly into parenthood, which is a phenomenal change in anybody's life, and how do we help to support people who are going through those different transitions. Again, I think what came up really importantly when Mark and Robbie and Paula were talking, it's about identifying not only the need and when it's needed and responding in a timely fashion, but it's also, for me, about given that support for as long as it's needed. And I suppose just other qualities that, again, going above and beyond, it's easy to do the basics, but how do we actually, show commitment and dedication, and how do we stay there for the longer journey. As Michelle has obviously, and I know the parent rooms are all about peer advocates and lived experience. So how do we utilize that experience, and how do we create a sense of empowerment in the people coming through services to maybe go from the people getting support to the ones actually giving support? And there's something really empowering and important in that. And also, obviously, and it's been talked about a few times today, easy access to supports. So I hope I'm not going to duplicate a few things that have already been said, but I think the fact that they keep coming up and up and up, that's something really important for us all to take away from today. And I'm sure maybe people speaking later on will also kind of tap into a few of these different things. So here's a quote from the Mental Health Foundation, again, just to focus on relationships. So relationships are one of the most important aspects of our lives. People who are more socially connected tend to, to families or friends or to the community, tend to lead happier lives. They're physically healthier, which is so important, live longer with fewer mental health problems than people who are less well connected. And I know earlier it was talking about early intervention and prevention. So if we can kind of tip the balance around where we are kind of preventing people from entering into long-term physical health issues and mental health difficulties, then, I mean, I don't want to come down to it, but, even financially, the impact that has is incredible. But also, we create this better tribe, this stronger tribe, this healthier tribe. We're protecting people against having some of those difficulties in their lives. And we'll come on to some of the impact that might then lead on to if it isn't addressed. So within Relate, obviously our focus is all around relationships. I mean, we're completely committed to that. And our mission statement is about having a future in which healthy relationships form the heart of a thriving society, or, again, you can put in there the word tribe. So much of the work that we do at Relate is around a relational focus to the projects that we have. And that's really apparent and obvious when we talk about working with couples and families, and we're working on communication. We're trying to kind of work with families perhaps where there's risk of domestic violence, or just even where there's family breakdowns, and trying to support families through those processes as well. We're trying to also work more and more with to sort of promote healthy relationships and kind of, again, that early prevention stage. And we're delighted because, again, through the Community Fund, we have been awarded funding to deliver a Golden Threads project, which is all about that. It's all about early intervention, and particularly into sort of rural communities. But even whenever we're working individually with people, we're also thinking in a relational kind of approach, and we're thinking relationally, whether it's the supports that they have within their families, their friendships, their communities, within their workplaces, but even their relationship with mental health, and what is the relationship with that mental health like, and how does it impact on their day-to-day lives, but also what strengths and resources are out there or internally that they have, that they can maybe make the changes that they need to live healthier lives as well. We know that obviously when we adopt that relational approach to mental health, what we can do is we can really see the kind of the continuum or the window of supports where per relationships definitely have an impact, exacerbation on mental health risks, and also good relationships can protect and promote positive mental health and well-being. So that's just a little quote around that. So the evidence indicates that good quality relationships are a crucial protective factor, which can prevent the propensity towards other issues that might come up, such as substance misuse, and also shield us from long-term health conditions, aid our recovery, and even prevent illness in the first place. And then, of course, on the other side, poor quality relationships also obviously increased risk factors for poor health and well-being. So not only do people in poor quality relationships have worse health than those in happier ones, but poor quality relationships are also worse for our health than having no relationships at all, which is kind of alien or strange to kind of think of. But obviously what we want to do is we want to really promote and give people the resources to kind of develop and improve their relationships where there are problems or issues there. So then if we look at stronger communities, again, what does that look like? And I think, so when we move kind of out of just the kind of day-to-day relationships within families or within couples, or when we move into communities, we really want to be thinking about, again, having that broader kind of view, or that holistic view of mental health, that it's not kind of seen as some kind of individual pathologized illness, which is a very kind of medical model, and instead kind of look at where's that person coming from with regards to, you know, what's going on in their social lives, what's going on in the political landscape, the economic landscape that could be impacting, and of course also what's going on with regards to those transitional stages. And you know, we talk about the family life cycle, so where are they in that family life cycle, and what are the pressures that they're experiencing at this time, because all of that can have a huge impact on an individual's mental health. And so we're normalizing and we're destigmatizing any of those kind of previously held views around mental health. And one of the hugest ones, of course, is, you know, the transition of becoming a parent. So again, we wanted to look at, from a community point of view, how do we encourage you know, early intervention and prevention, and perhaps awareness that some of these transitional stages are difficult for people, of course, and also to adopt that relational approach to mental health and well-being. We're also kind of, and I think that came up earlier in some of the discussions around working in partnerships. So I think the days of working in silos is long gone. We obviously have a fantastic relationship with Parent Rooms, and we're really privileged and we're really proud of working alongside them to support new parents and to support perinatal mental health. And within our own organisation, obviously, we can work across different service lines that we have to share the knowledge and share the different experiences that are going on, whether it's in our young people services or couples or families, but also sharing with the wider community and other organisations, and again, utilising the skills and services that each of us have. And again, we need to keep lobbying. You know, I know I'm sort of talking about services that are already really in the forefront, but it is about keeping that momentum going. So much has already been done with regards to, you know, the pushing towards increased perinatal mental health services, but we're not quite there yet. So we need to keep that momentum going and keep lobbying and working together, and talking about what needs to still be done and who's going to do that. So working together as a partnership. So the transitions that I mentioned, I suppose for us, you know, we would be really aware that any transition, whether it's positive or negative, no matter how you view it in life, it requires adaptation and change. So that can always elicit a degree of stress. So, you know, becoming a new parent can be a really exciting time for people, but it can also bring a lot of stresses. And then there's also times where maybe that process doesn't go as we would hope it would go, and then that can also create an awful lot of stress as well. So obviously, if we can overcome some of those, yes, of course, it can lead to resilience and growth, and we can kind of weather that. But if there's ongoing stress or too much stress or nothing to relieve that stress, then eventually, of course, it will have an impact on our mental health. So I just wanted to highlight, and again, I know these are maybe kind of obvious, but some of the main transitions for parents. So obviously around pregnancy in itself, and of course there's a whole journey in that issue as well, and fertility issues as well. So then the actual becoming a parent, and as Michelle mentioned earlier, obviously whenever there's a traumatic birth, the impact that has you know, on the whole family, on mum and dad and baby, and then the wider family as well. So those are really important to bear in mind whenever somebody is coming to one of our services. Again, maybe things like moving house, or maybe just trying to kind of deal with, you know, the extra finances that having a family can put on parents, lack of time for themselves, even just trying to organize or discuss, or sometimes not discuss is the problem, the roles and expectations of each other within the couple relationship. And a lot of the work sometimes we do with couples is around kind of unearthing some of that, and encouraging partners to to communicate a little bit better in what their needs are and how do they work together to support each other. And of course, within our services, we have a number of psychosexual therapists as well, because again, birth trauma or, just even recovery after having a child and the impact that that can have on a couple's sexual relationship is an important area to be able to bring that and talk to someone about. And of course, losses and bereavements. And then again, as been talked about today, having a child doesn't end at any point, that child continues to need your support throughout their life. And then those changing needs, how do we adapt to those changing needs? And again, supporting families through all those different stages of that family life cycle. So again, just looking at that support, how do we look at, sorry, I've just got something popped up on my screen. So again, looking at support for the family. So raising a family, as we know, is a lifelong commitment, as I've just said. So again, those services need to be there for the long haul. And I think probably one of the criticisms or critiques of how things have been funded perhaps in the past is, that funding is short term, and that doesn't work whenever you're trying to commit to supporting families for, the duration of childhood and into early adulthood. So again, we need to look at that, and we need to think about how do we support services for a longer period, and how do we create that stability and trust and consistency. And I kind of think it's a bit like modeling what a parent does for the child. They create that stability, trust, and that consistency. And if we're trying to encourage parents to do that, then they need the services to also be stable and trustworthy and consistent. They need the support of the staff that work there to also be there, and that continuity of relationships. And again, it's coming back to how important relationships are there. Again, those funding issues, they need to be there to be able to reduce waiting times. And I know one of the things Michelle and ourselves were really keen to establish was about that immediate access to supports when it's needed, and that's so critical for new parents, or wanting to, when they need it. There's no point in offering that service when things have kind of escalated and moved to a different point altogether. So we want to be able to be timely and to offer that support when it's needed, and also the appropriate level of support. Not all new parents will need kind of therapeutic intervention. So again, it's about assessing, actually, is it kind of some tips, or is it just hearing somebody else's experience? So that support should meet the needs of where the family's at, or where the individual's at, and just trying to make sure that it's kind of getting the right level for the person. There we go. And again, I suppose going above and beyond, and we talked about everybody here being a committed citizen. So I think, again, I don't need to overly label that, but again, that for me, that comes down to, staff care and self-care. And, it's undoubtable that COVID has had an impact on healthcare professionals. A lot of people have been asked and expected to go above and beyond. And that takes its toll as well. And of course, we all come from our own families. So the impact that perhaps the pandemic and lockdown and COVID has had on different, on our own lives and our own family situations has been really, really difficult. So there's kind of an awareness that there needs to be lots of support for people who are supporting other people. And otherwise we will get, a whole level of support that are unable to help other people, perhaps having to attend to their own mental health or their own physical illnesses. I think also on a more positive level, it's also about creating, opportunities and creating, a service where people really want to come into. So whether it's through voluntary or whether it's, through paid professions, but it's making sure that there's adequate training. And I was delighted when Michelle was talking about their peer advocates, and there's the OCN level 3 available there. Obviously, for anybody working within our services, they will be suitably qualified and trained to work in the area that they're working in, and they are really, really specialized areas. So, and we really encourage that growth in our our staff and our counsellors to sort of refresh and renew their training, and have an ongoing enthusiasm for what they're doing, and have that career satisfaction. But I think also within our communities, we also need to take that holistic approach and that relational approach across the organisation. So not just in the relationships that we have with people coming into services, but also within within the actual organisation and the staff self-care. And that could be through, you know, various things that support staff, like supervision. It could be through having an opportunity for them to come together and share themes or issues or what's going on for them, and also through staff wellbeing programs, so such as, you know, AEP programs, to support staff, because again, as I say, they have families as well, and it's about how do we support them as parents as well as workers. And so again, the lived experience, I think that's another way that we can create these, the committed citizens and the kind of the tribe, the building this tribe that we've talked about today. So again, this is where knowledge and skills and empathy are so important. And it's so important because they can really help to shape, you know, policies and services, and it can really help to I suppose, create that environment in which people will come in and feel respected and understood, and that they can share their experiences. And back to that normalizing, so normalizing and reduces any kind of stigma that any parent might have, to hear somebody else having gone through what they've gone through and be able to offer practical advice and solutions, can be so vital, and particularly if it's that timely intervention. And just hearing somebody else who has walked in their shoes to have experienced that. And as I said at the very beginning, that sense of empowerment that actually brings to the individual who is helping, you know, I think that is so important, to have been there and then be able to support somebody else. I think that's crucial to creating the compassion that we need within this sort of regional tribe. And then I'm nearly there, so don't worry. Easy access to supports. So again, this has come up, and we have to be really aware of that. And I think probably as a service, we've diversified in this area more than any other over the last 18 months, because we're so aware that, you know, obviously there are different ways of working, and we can access different people who may have previously not used our services so much. So having that kind of awareness, first of all, that the services are out there. And I think as anybody who was listening to Robbie earlier, who was talking about that couple who just needed support, but they didn't know where to look. So having awareness, first of all, and again, I think that's where partnership working can be so crucial, because, you know, if we know who has different services available, that is critical to making sure that we are as effective as we can be in utilising the services that are out there. So we have kind of developed a whole range of different services now that are online, and they're available on our website. And we've got a link there, obviously, to some of the digital self-help resources that we have, and those have gone down fantastically well. And there's short little video clips, there's also tips and advice, so that's all there and available. But I think other services, and our service is not a walk-in service, but I think also having services that people can walk into, and again, Michelle mentioned earlier about self-referral, and I think it's really important that families can sort of navigate those systems, and not necessarily have to go through like a gatekeeper or a cumbersome system to access services. We want to make this as user-friendly as possible, and for other professionals to be able to refer into different services whenever they're working with someone. So that's really crucial. And as I said before, you know, and it came up earlier as well, early intervention and prevention, and there is a lot more focus now on ensuring that there is those services at that early intervention point. We will still always need, and we'll always have, those protective services which would maybe come in at a kind of a higher tier, and having that therapeutic intervention is so important. But not all families will always need that, and not all parents will need that. So sometimes it's just somebody at the right time to just give a reassuring word or a bit of advice, or, you know, just tell them it's okay not to be okay, is so crucial. And it's there, and it's available to them. So it's I don't know why I put this in because, you know, it's not just I'll say like a relational approach is critical to mental health. It's in the NICE guidelines. You know, as I said, we already are really aware of how important it is to develop that kind of relational or that systemic approach to working within relationships and working with couples, and there's a lot of evidence there to support the use of couple and family therapy. But we're also kind of aware that there's more and more support about including other family members. So when an individual is referred, you know, who is in their family network or who's in their kind of eco map of their life, and how can they be brought into, I suppose, that person's recovery to wellness. And it's about looking at utilizing all the resources and supports that they have in their life, and that includes community supports, you know, what's in their community that can support and help them. So that's just a little recap of some of the services that we have that help to build this tribe. And you know, certainly if you want to ask me about any more of those, I'll run through them, but I'll not go through too much of that now. And those are just some of the people that have used the service that has been set up with Michelle and the parent rooms. So these are just a couple of quotes that we've received back, and we're just so delighted to be able to do that and offer that support. So I'll let you just read those yourself and leave those up there. And I think I'm bang on time. I can't believe that. How did I do that?
Oh, fantastic. Sharon, thank you so very much. We do just have one question in the chat, which we'll go to, if you don't mind, just before we finish up. And Karen has asked, do you offer counselling with maybe a parent and a child? So maybe you would be able to answer that for us.
We do, yeah. I mean, when we talk about family therapy, we're talking about any members of that family who want to avail, and who, you know, and there's obviously a specific reason, or there's reasons for them wanting to come. So that could be a parent and child, and very often it's hard to get the whole family in the room anyway. So quite often it may be one parent with one child, it could be two parents with one child, it could be one parent with 3 children, and it can be a caregiver, it can be granny, could be there, or an auntie. So we just see family as how you define your family and who needs to be there. And it's obviously discussed and negotiated with the therapist, but we'll work very much with who needs to be there. So thank you for that question. That's great.
Yes, thank you, Karen, and thank you, Sharon, so much for answering it. And thank you for your wonderful presentation. That was really helpful. And as I said at the start, we really are delighted to work alongside Relate NI in so many different ways. And just to pick up on what you said around the campaigning, we completely agree. There is so much more that we need to continue to do, particularly around the mother and baby unit. So we're very excited about the specialist perinatal mental health teams, which are coming. We are very aware here at the parent rooms that the mother and baby unit is something that is on our agenda. And so we completely agree with you that campaign needs to continue, and we look forward to working with everybody to make that happen. Well, thank you again so much for joining us, and thank you for the partnership with Relate NI. It's absolutely fantastic. And thank you to all our attendees. I hope you really enjoyed what Sharon had to say, and obviously you can go onto their website to find out more about what they do, or if you want to connect with her in any way, I know she'd love to chat with you further. Our next session, Christina has very helpfully put the link to our next session in the chat, just to make it a little bit easier for you. And our next session will be with Alan Guthrie, who is a social worker in West Belfast, and we're going to be hearing from him in just a minute. So again, I say thank you to Sharon, and I will see you all again on the other side as we join into our next link. Thanks all, bye-bye.
Thank you.